I'm Andrea Klein-Thomas, a reporter with CBS New York here at the 5th International Vatican Conference. We are joined now by Bob Garrett. Thanks so much for being here.
Thanks for having me, Andrea.
Oh, this is so great. You know, as you all discussed, part of this conference, one of the themes is about treating the whole person. This is different than your typical medical conference. Why is it so important to take a holistic view and have a conference where all these stakeholders are right here at the table?
Taking a holistic view is so important because if we're going to transform healthcare, which many of us are committed to doing, you have to not only look at the medical issues that patients have, you also have to really examine some of the social issues out there, those so-called social determinants of health, whether that's food insecurities or housing or transportation or even financial issues, because they are impacting health and health outcomes. And bringing various disciplines together at a conference like this, you can really have a discussion that could make a difference and make sure that we really do address this from a holistic perspective. So you have clinicians, you have researchers, you have administrators, you have government representatives, and it's really going to take that entire village, if you will, to transform healthcare. And it's great that they come together at the Vatican conference. It's unique in that sense. Oftentimes, you don't see all those key stakeholders sharing ideas and discussing these issues in one setting. So I think that's what makes this conference unique, and I think it's really important if we're going to transform healthcare by addressing the problem from a holistic perspective.
And you were talking about transforming healthcare. We understand that you have a medical school. Tell us about what is different about that curriculum that can improve the outcomes for patients.
So thank you, Andrea, for asking me about the medical school. We're really excited about it. It's been in existence for about 3 years now. It's the first private medical school in New Jersey in over 60 years. And what makes it different in terms of the curriculum, I think, are two very, very key programs. One is a human dimension program where medical students actually get paired with members of the communities that we serve, particularly underserved communities. They follow those individuals, those families, for their 3 or 4 years of medical school. They're empowered to intervene, and they really understand firsthand why prevention is so important. Prevention is as important as treatment. They understand firsthand some of the social barriers and the social determinants that impact one's health. And I really think that makes our medical school and that curriculum a lot different. The other piece that I would point out is our interprofessional academics program. So you have medical students that are actually attending classes with nursing students and other allied health students. And some of the barriers that have existed between those groups, traditionally have been broken down. And that's so important because when they get out there and they practice medicine, it's really a team-based approach where we find the best outcomes occur. So to break down those barriers early on in medical school, I think is very, very significant. And that program's been a huge success as well. Those students are actually, as I said, they're attending class together. They're sharing science laboratories together. They share their experiences. So the students that come back from the Human Dimension program, where they're out in the community talking to some of these patients and families that they've been following for years, they're sharing those experiences with their nursing colleagues, with their allied health colleagues, and I think that they're all very, very valuable.
And it's really important because the first class graduates this spring.
Yes.
And they're going to go.
We're excited about that, and that's the first class that some have opted for a three-year trajectory, so they're going to actually be graduating medical school a year earlier than what is normal. And what's great about that is that they will have the opportunity to do their residency program at one of the Hackensack Meridian hospitals. So it's great for us because it kind of assures us kind of a pool of talented physicians for the future. It's also great for the students. They get to save a year of tuition as well. And, medical school affordability is still a very, very big issue out there. So I call that a win-win, a win for us, a win for the medical students. And we're excited that I think there's 19 of them that are going to be graduating in June that will be starting their residency programs at one of the Hackensack Meridian hospitals. Really exciting.
Very exciting, Bob. Thank you so much for joining us.
Thank you so much for having me, Andrea.